Hey everybody, it's Tim Miller for the Bulwark. Make sure to subscribe to the feed if you haven't, because you know that if you see me and Sam Stein together, something's
bad.
Very troubling has happened in the news. Yes, that has happened again. I'll just read from the latest statement from Mar-a-Lago. From the desk of it's President-elect Donald J. Trump. They're already calling him president because he never left.
Oh, yeah, he never left.
Yeah. Here he says as follows: I'm very pleased to nominate Dr. It's a good sign. It's going to be a doctor.
It's a doctor, right? Oh, good.
Dr. Mehmet Oz to
Man.
serve as the Centers for Medicare and Medicaid Services CMS administrator. Make America Healthy Again. Maha is on there. He goes on. He's an eminent physician, inventor, and world-class communicator. Has been at the forefront of healthy living for decades. I don't know how you're at the forefront of healthy living, but anyway, Dr. Oz will work closely with non-doctor Robert F. Kennedy Jr. to take on the illness industrial complex. Okay, well, before we get to your thoughts...
Did he mention his primetime Emmys in there or no? Did he? I forgot.
I don't see any primetime Emmy shout-out.
Okay.
Maybe that was on the bleat. Before we get to the Oz, I have a quick quiz for you. Quiz. You've been around D.C. for a long time, and you've been a serious policy reporter unlike me, so I want to know... Can you name another Centers for Medicare and Medicaid Services administrator? CMS
I could, but now damn it, you're gonna make me look stupid. I definitely could back in the day, but now you're making me look silly. No,
I can't, and I'm not making you look silly because
I could.
We are not supposed to know the name of this person. This is not the job for a reality TV host that is a world-class communicator. You are running a bureaucracy. We're just looking for a pencil pusher, like a bureaucrat, somebody
that's it. Yeah.
A nerd. Like you just want a super nerd who cares about making healthcare for poor and elderly people function. That's what you're looking for in this job.
Yes.
But they've gone with Dr. Oz. Talk to me about your initial reactions to them.
I'm not shocked, I guess, because it's of course it's Dr. Oz, right? I guess my shock is why not Dr. Phil? And maybe he gets FDA. We will have to wait. On the flip side,
I think you just jinxed it. Dr. Phil's definitely going to be in now.
I didn't jinx anything. These things are preordained. On the flip side, CMS is depends, I guess, how you view government, because I know you're a big NatSec guy. So, but on the domestic policy front, this is about as big as it gets, right? You're administering Medicaid and Medicare, massive government programs. And you should have... Look, even if you're not a doctor, and even if you're not a TV doctor, I do think it's supposed to, you should probably have some pretty good managerial skills, or at least some familiarity with how governance works. And I guess the thing that really kind of gets me, Tim, among the whole list of things is this and RFK Jr. It's maybe I was naive, but I feel like he should know better. Trump should know better. The last year of his presidency was such a disaster with the COVID pandemic that anyone would leave that experience saying to themselves, man, I got to put in some at least competent folks at these health agencies in case something like this happens again. And instead, we're getting a TV doctor and someone who doesn't believe in vaccines. And boy, you're let's hope that nothing shitty happens, but I think history tells us that that's not going to be the case.
Yeah, it's Andy Slavitt. You're going to be really upset.
Oh yeah, of course. I knew, and I knew Andy Slavitt. That was Obama's guy. There was other people.
Yeah, Seema Verma was the CMS during Trump's first administration. Not also top of the line either, as far as bureaucrats are, but she had some relevant subject matter experience, having done healthcare governance in Indiana before getting promoted to the federal level.
And she got the job because she was close with Mike Pence, and she had worked on Obamacare stuff, and she knew the bureaucracy, and she administered Medicaid programs in the state. They knew how this stuff worked. Dr. Oz knows how TV works. I'm sure Dr. Oz will have a nice studio at the CMS headquarters, but boy.
Well, here's the thing, though. Here's just another point of view, Sam, is that if you don't have the relevant area expertise, if you haven't run a big organization, if you don't really know, how the levers work at this particular bureaucracy. You still want to make sure that you have somebody that has like good judgment in the cases of crisis, or in the cases of where there are these sorts of offsetting issues where you're trying to make a judgment of, can we cut here or can we cut there? And Dr. Oz has shown that kind of judgment. I want to play this clip from you of him talking to Sean Hannity during COVID.
Dr. Oz, help us. Well, first, we need our mojo back. Let's start with things that are really critical to the nation, where we think we might be able to open without getting into a lot of trouble. I tell you, schools are a very appetizing opportunity. I just saw a nice piece in The Lancet arguing that the opening of schools may only cost us 2 to 3% in terms of total mortality. And, that's any life is a life lost. But to get every child back into a school where they're safely being educated, being fed, and making the most out of their lives with a theoretical risk in the backside, it might be a trade-off some folks would consider. We need to get industry back, supply lines. I mean, things that we can do without putting the nation at risk.
Dr. Oz was willing to sacrifice 2 to 3% of our children to open schools. 2 to 3%. And that is an insane number. Like 2% of Americans is like what? Almost 7 million people. And we lost a lot of it. Dr. Oz was like ready to be like, that million that we lost to COVID, I'll put another 6 mil. Let's just throw another 6 mil on top of that. Tim. No harm, no foul. And it's worth it. It's worth it.
Tim, can you really put a price on mojo then? What is the real price? I mean, how much?
By the way, I'm sure that I had much more libertarian views on school opening than some of our our viewers and than you. Thing. But like, this is insane. It's like, if you could, this is to me, this is about a judgment question. It's like you come to me and like, Tim, here, I have this paper from the Lancet for you. And I know you want to open up schools again because you think that would be better. But this paper from the Lancet says 3%. We'll have an additional 3% mortality if we do that. Like,
that's the thing. Yeah, that's the thing, because it's crazy. So, like, look, 2020 hindsight, right? School spreading was probably overstated. Certainly masking and schooling was overstated. But at the time, you have to just consider what he was saying at the time. We didn't know any of this stuff. Like, we were kind of flying blind. And in that moment, when we have to make moral judgment calls, like Dr. Oz was like, look, the mojo is worth it. Like, let little Johnny perish. We got to get our mojo back. No, and this is fucking nuts. I mean, what are we doing here? Like, obviously, here's the thing that kills me is, like, it's one thing to put RFK atop HHS.
The bear was in my car, and I didn't want to leave the bear in the car because that would have been bad. But I said, let's go put the bear in Central Park, and we'll make it look like he got hit by a bike.
And be like, you know what? Fine. But we're going to, like, get him all really credible and competent deputies. But then you're like, no, actually, let's keep going. One more level on the bureaucracy. Let's just go. And then we're going to find out tomorrow that, like, the person who's running state coordination at CMS is going to be like, Judge Judy. And we're going to be like, okay, when does the level of, like, the competent people start coming in?
Never.
And good God. And
you've got to be careful what you suggest. I had suggested Jesse Waters for Secretary of the Navy because the name. Thank you. And now the leak has come out that it might be Sean Spicer. So you got to be careful what you wish for.
I know. Jesse Waters would have made a great Secretary of Navy, and Sean Spicer should have been at Food and Drug because he's
spicy.
Yeah, spicy.
I get it.
Man, why are we doing these videos? I guess they're cathartic because
why are we here? Like, why do we exist?
We sit and we talk. We sit and we talk, and we're like, oh my God, is it? There's like a surrealism to it, and we're sort of like, is this real? Can we laugh at this? And I guess I sort of have to laugh, right? Like, we do. Yeah.
I guess, is this like a question about existentialism, or like what is our purpose? Or
like, started the president. We're like 60 days away from the presidency, and I'm there. Yeah.
It's like Camus. I guess. I don't know. I mean, I think that we do the videos because people need to know what's happening. Yeah. And we might as well laugh at it for now, at least until
you think he gets confirmed? Is it a confirmed
the rise
position?
Of measles, mumps, and rubella.
Hold on.
Yeah, everybody gets confirmed. Everybody gets confirmed. Like what? Like the Senate is not going to have the balls to do anything. Like, they might block Gates. That's it. Gates is the only one. Or I guess if there's more evidence that Pete Hegseth like literally raped somebody, because we know that like, you know, certain things like finger penetration, that doesn't count as rape in MAGA world. So Trump, that because you know Trump has already been found liable for that. But like I don't know. Maybe there's some level of rape that might hurt Pete Hegseth if more was to come out. But besides that, I think Gates is the only one on that's even the question.
Yeah, I don't think Oz is going to get tripped up by the Senate. What do they care, right? They don't give a shit about this. I mean, I think Kennedy.
Most of these guys want to get rid of Medicaid.
Well, yes, that is true. Except the irony, of course, is that Trump, I mean, he's a charlatan, so who knows? But like this, he is like Mr. I'm going to protect entitlements and I'm going to change the Republican Party and all that stuff. And so, but then you have Elon out there, like, and I don't know if you've been following his Doji tweets, but they're like, you know, a lot of it is focused on Medicaid, and certainly there's billing fraud and stuff like that where you can actually go after waste in Medicare. But boy, it's like, you know, part of this makes me wonder if they're going to have like the right competence to do actual real damage, or if they'll do the damage through incompetence. And I just don't know.
Well, and this, I guess that's a good question. And that goes to your serious question about why we do these videos. I do think the Medicaid being on the chopping block, not completely, not the whole program, but like at some level, cutting back on poor folks' access to healthcare is like possibly the most underreported likely thing to happen in the next administration. Like because Trump is really talking about old people when he's talking about protecting entitlements. Like he's talking about Social Security and Medicare. Sometimes he throws Medicaid in there. Does Trump even know the difference? TBD. But I think that the people around him, the Project 2025 crowd, like that is an appetizing place for cutting poor people's healthcare. I know this is a working class party, but
there's a widespread perception that Medicaid is health insurance for poor Black people. Yeah, and the truth is, more white people are on Medicaid than Black people. I think they're in for a world of political hurt if they do this, because a lot of their voters are dependent on this stuff. Yeah. But yeah, I think this is where they're going to take their real budget focus. Now, of course, got to work with Congress a little bit here, but I mean, they're going to do what Trump tells them.
They're going to need cuts somewhere, man. If they want to extend the Trump tax cuts, what they want to do, you know, if they want to do their other goodies, they're going to need to find cuts somewhere. You can't. I mean, I know that Trump thinks you can just tariff it all, but you know,
well, I guess something has to give, because you can't just give away tax cuts without some balancing of budget and reconciliation.
Right?
Yeah. Okay. We'll see.
So we will see. All right, Sam Stein, I came to you. Any other deep thoughts on Dr. Oz?
I know everyone wants to focus on the crudité video. Maybe we could play that, but it's kind of old. It played out.
Didn't do a lot for me.
At Wegner's, and my wife wants some vegetables for crudité.
Yeah, I thought that was actually thought it was kind of like a little cheap. Like you just wanted a little veggie platter. Couldn't find the word. Couldn't find the word, so we went the French one, I guess. Crudité.
I might go have some crudité myself after this.
Yeah, it's about time. You know, it is. We're recording this at 5:20. This is my crudité hour. I'm missing it, so I should go.
All right. See you, Sam Stein. Everybody else, subscribe to the feed. We'll see you here soon. Peace.